Hi, welcome back to Q&A. My name is Sarah Archer, and today I'm joined by Bill Brewer, who is our Oracle Cloud Healthcare Product Manager. Bill has years of experience, and I'm going to let him kind of introduce himself. Bill, welcome to the show. Give us a little background.
Yeah, thank you, Sarah. Glad to be here today. Thank you for everybody for tuning in. Bill Brewer, as Sarah mentioned, and joined RF Smart just a couple months ago, but not new to the industry. Spent about 15 years working in healthcare supply chain, largely at healthcare providers around the country. So super excited to be here and look forward to our conversation today, Sarah.
I'm looking forward to it too, Bill, especially because it is so relevant to the way the world is going right now. We're going to talk a little bit about the pandemic, about healthcare, just the industry in general. Bill, I want to start off just with the question, how has the pandemic impacted healthcare?
It's a great question. And I don't think we yet fully know the answer to it, if I'm being honest. Before I even dive in, though, I want to take just 2 seconds and because I think I'd be remiss if I didn't. And since we're talking about COVID and since we're talking about healthcare today, I think it's important to just recognize the sacrifice and the tremendous amount of work that everybody involved in the healthcare continuum, from the supply chain to the front end providers and everything like that, continue to do every single day the work to take care of patients. And we would not be where we are as a country today without all that effort. So on behalf of myself, RF Smart, just want to say thank you. But Sarah, getting to your question in terms of the impact on the broader healthcare industry, I think what will happen is when we get through this, and by the way, we will get through this, I think we will step back as an industry and we will really reevaluate. And one of the largest areas I think that we have to look at is how we better manage for demand. And so what overwhelmingly has been the challenge throughout all of this is, be it supplies, be it people, be it just physical space, ICU beds, hospital beds, ventilators, whatever the case may be, we've struggled. And when you look at extremely dense areas of the country with high populations, that's where we struggled the most. And so I think we absolutely have to step back and really just look at and understand how we better respond to that demand. Now, that being said, I don't think that's an insurmountable challenge. After 9/11, as an industry, we went through a tremendous amount of work to really begin and beef up our emergency preparedness plans. A lot of federal dollars, a lot of private dollars involved in doing that. And so we'll do the same thing as an industry. But ultimately, I think that's the question we have to answer is, be it people, supplies, whatever the case might be, how do we do a better job in the future of predicting and responding to that demand? So I think that will be the long-lasting impact, is we will better understand that. So that ultimately we can do what we come to work every day to do, which is for the healthcare providers to provide outstanding patient care. And that I think is what we will focus on.
Yeah, there's certainly so much that we can't predict right now, or that we might talk about, here in just a moment about the future. But as of right now, how has the pandemic impacted supply chain specifically?
Yeah, great question. And for any of the supply chain leaders on the call, my hat goes off to you for the work that you're doing every single day and your teams are doing. I actually came from the same role just a few months ago, and would wake up every morning thinking about how we would get the necessary supply where it needed to go. So Sarah, I think the beginning and perhaps the most obvious answer is PPE. And so we've heard about it in the news, personal protective equipment. How do we better manage, or really as an industry, we've struggled to get it. And I think one thing to talk about and to understand relative to PPE is really, it was the perfect storm. And so if you go back to the early part of 2020 and look at January and February, what you saw is as COVID began to ravage mainland China, we began to see the initial steps of a disruption to the supply chain, because we began to see plant closures there. We began to see ports shut down. And so we were already, and I was living it in March and April, even before COVID took full root in the US, we were already dealing with shortages of things like surgical gowns. And that was because of the upstream impact that had happened with the global supply chain. And then when it hit this country, the demand went up, and it was just sort of the perfect storm that came together. So I think one thing that we have to sort of step back and think about is, when we think about how we manage supplies and inventory in the healthcare industry, it's largely a transactional enterprise, right? We bring supplies in, we move them around the facilities, we use them, and then we sort of rinse and repeat the same process. And so I think the answer to that is whether it's PPE, ventilators, whatever the case might be, that may have served us in the past, but it's not going to serve us in the future. And so I think we've got to really step back and look at how do we better plan for these things, and how do we, make investments in the right systems and the right processes and the right people to make sure that we don't find ourselves in that place again. And one last point I want to make, Sarah, is that that responsibility doesn't just fall on the healthcare providers. So this is a continuum. This does not begin and end with the healthcare providers, the front end workers. There is also a lot of work I think that needs to be done on the supply side, the manufacturing side, the distributors, because ultimately we're all in this together. And it's a complex equation of how product gets from raw material to the actual point of use. And so we've got to reevaluate and look at all of those components, because ultimately, to your question about the impact, all of them have been impacted.
And so as we evaluate and we look towards the days to come, what are your predictions for the future of the industry and of supply chain?
It's a great question. I think planning is a very, very big part of that. So, I'm going to start with supply chain because I think it's a good place to begin that conversation. And I sort of alluded to it in my prior response. When we think about something as simple as inventory management, for example, how do we manage product, where it sits, how it comes into the facility, how it gets distributed out? I hearken back to this example that was shared with me of a healthcare provider very much in the depths of working through COVID-19, trying to manage supply. And one of the things they shared with me is that every single day they were having their frontline folks go out and manually count where all of their masks were, where all of their gloves were, where all of their gowns were at, and manually compiling in Excel spreadsheets what the forecasted demand was and all those types of things. Well, that serves the need, but I would argue we've got to do better. We've got to move the needle to a much more strategic supply chain in healthcare, because that is how we're going to improve. That's how we're going to do better. And so there are examples of demand planning, automation, things that work in other industries, and ultimately the right ERP system as well. Because at the end of the day, if you're working with antiquated systems and you don't have ways to automate your supply chain or things like that, then you're going to struggle. And so the other thing I would say too, and sort of more broadly, is anyone that spent any time in the healthcare industry knows one mantra, which is we always are asked to do more with less. And one of the impacts, I think, of the pandemic on the healthcare industry that hasn't been talked about a lot is the fact that we've seen tremendous cuts in staff and people that are on the front lines of taking care of our facilities. And so you look at some of these stories and there's 50, 60% of the workforce of some hospitals that are on the, taking care of patients that had to furlough their staff. And so the question also has to become, as it always has been, how do we do more with less? And I think that really is going to cause us to step back and think about some strategies to do just that.
So, Bill, I'd love to talk about some of those strategies that healthcare providers can leverage. I know one of those things, of course, is using a mobile data collection system. And so I know you're going to talk about that a little bit and why you would recommend that. But could you just give us some ideas about ways we can build a stronger supply chain?
Yeah, great question. So first off, I think it includes involving everybody in the supply chain. So we need to bring the distributors to the table. We need to bring the suppliers to the table. This is, again, as I said earlier, not just a provider side problem. So we've got to get all of those pieces and parts working together. A great example, Sarah, is when you look at distributors, which play a critical role in the healthcare supply chain. We work through the system of what are called allocation. So it's a methodology by which we say this provider is going to get X amount of product, this provider is going to get Y amount of product, and so on and so forth. The reality is that hasn't really served us extremely well during this pandemic. And so I think, it's things like that we have to do a little bit better on. But ultimately, you're absolutely right. I said earlier, we're going to be asked to do more with less. I think what we really have to do, and what I would challenge all of my supply chain counterparts across the country to think about, is how you reduce touch points. Because we touch and move and transact a lot in healthcare. We move product from point A to point B to move it from point B to point C, and so on and so forth. Anyone that's lived it, you know exactly what I'm talking about. We've got to figure out how we do that better. And by the way, when we do it better, that also means tracking and managing it, because we need to know where it is. We need to know what the demand is. And then we've got to employ these principles. And again, I don't want to dismiss, because there's healthcare providers that have thought about this and have been doing this. but there's a lot that haven't. And so whether it's an investment in a cutting edge cloud ERP system, whether it's an investment in inventory management and automation technologies like RF Smart, where we can automate things like receiving inventory counts and things like that. Sarah, this isn't a plug for RF Smart, but ultimately whatever we do, we have to become much, much more efficient. And the only answer to that is through technologies and solutions to do that. And so I would argue that's the challenge for the supply chain is, again, how do we do more with less? How do we implement automation? And how do we better track and manage inventory? Because if we can do that, I think we'll be much better prepared for the future.
And it all comes down to providing excellent patient care, right? Like we want to make sure that our patients are being taken care of, that the people who are affected most have what they need. And so I think that that's great advice, Bill. Thank you so much for coming on for just a little short video today. I want to thank those of you who are watching us for joining. I also wanted to let you know that in addition to these Q&A videos, we've just launched a podcast. So we've got a podcast called Taking Inventory. It's all about supply chain, all about bettering your inventory, making sure that you have what you need on hand, and all sorts of industry tips and advice around that. So if you haven't checked that out already, there will be a link to it in the description of this video. Go ahead and check that out. Thanks again, Bill, for coming on and for all of your great words of wisdom. And we'll see you all again really soon. Thank you.